Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafa and welcome back. Tonight we are discussing bipolar disorder. Joining me is ExpressCare's Dr. Jitka Lom. Let's get to some of your questions. All right, Doc, our first question is, what happens if I quit taking the medication?
Well, it depends a little bit on where you are in the cycle. If you're in depression and you stop taking your medicine, it may become very dangerous for you and you may become even more depressed. On the other hand, if you've taken the medicine for quite some time, maybe six months at least to a year or longer, then it may be that your mood has stabilized and you might be okay, but it's something you shouldn't do on your own. Do not quit your medicine on your own. Please continue to take it and be monitored by your physician. As far as from the mania side, if you quit taking your medicine, again, it can be very dangerous. People land in jail because of the crazy things that they've done when they were in their manic phase. So keep taking your medicine. If there's a concern about it or you're having a side effect, you can easily talk to your physician and a different one can be substituted. There are so many available now.
Okay. Our next viewer is asking, are there any programs that can help manage bipolar disorder?
It's very important that you partner with a therapist to help you, and if there's a support group or even other people that you know that have bipolar affective disorder, that you can get that support. It's a very difficult thing to live with, and that's what I think is very important.
All right. Now, our next viewer is asking, are women affected by bipolar disorder differently than men?
It's more common in women. And another thing is that it comes, sometimes the diagnosis is made in childhood actually, that there are sort of two peaks when bipolar tends to rear its head, and one is in the teenage years, 15 to 19, which is a hard diagnosis to make because teenagers are often so moody anyway and impulsive, and maybe coinciding with other mental illnesses, for example, attention deficit disorder or an anxiety disorder or even drug use. There are a lot of different things that can be coming into play there. And then in the second sort of peak is in the 20s. Usually in the 20s, young people will tend to get diagnosed.
Okay. And our last viewer's question, we talked a little bit about it earlier. The person is asking if it is hereditary. Now I just wanted to add on to that a little bit and ask if bipolar disorder is something that you can grow out of, or if this is a lifelong disorder that you have to continually manage.
It is a chronic mental illness. At this stage, it is not a curable condition. It's one that is controllable and treatable, which is a blessing, you know, and that the medicine exists. But it is something that most people will have to deal with throughout their lives. Sometimes in their middle age and later on in life, it will sort of burn out and be less extreme like it was in their youth. But it is something that they're going to struggle with. Oftentimes the mania sort of becomes less of an issue, and then the depression is an ongoing thing that they will struggle with.
Okay. I also had another question. We mentioned earlier that there were triggers, environmental triggers. Can you share with us what are some of those environmental triggers? Is alcohol?
Alcohol, drugs, for sure. You know, any sort of substance like that, alcohol or any street drug, does affect people's mood and it can trigger them off, so please stay away from that. If there's a family history of mental illness in your family, definitely stay away from drugs. Stay away from them anyway, but especially if you have that. Another trigger would be severe stress, severe anxiety, severe sleep deprivation can really put people into a bad state where their mind is not stable. So if your family member has bipolar affective disorder, if you have it, you try to maintain a very even, stable lifestyle, cling to your routine. That would be my advice.
Okay. We were talking earlier about living with a person with bipolar disorder and how sometimes they can go into very depressive states where they want to sleep all day.
Right.
Is there any way that the support group can snap that person out of that state?
Yeah, it's really very difficult. I'll tell you, people have that perception that they can talk somebody out of it, that they can snap them out of it. This is an emotional disorder. It's on a completely different level than being rational. I compare this in a completely different way to the emotions that you might feel when you fall in love, which are extreme, elated, joyful, all of those emotions where people would not necessarily try to talk you out of it because it's impossible, right? In the same way, when somebody's in a severe depression or in the mania, but especially in depression, it's very hard to talk them out of it. You could work at it on a spiritual level through church and prayer and all of that, but they really do need professional help. They would need, for sure, some counseling and some probably medication to help them if they're in that severe state, because when they're withdrawn and sleeping all the time and not interacting and going in, the final outcome of that is suicide, and we just really don't want that to happen.
Okay. Earlier you talked a little bit about the symptoms and how a doctor, of course, diagnoses you. At what age is a person diagnosed with bipolar, or can they be diagnosed later in their life?
Oftentimes they'll be diagnosed with depression earlier on, because that is a much more common feature of the bipolar affective disorder, especially the bipolar 2, where, basically depression may be something that they've had a bunch of episodes of, and they've been treated and recover and they're okay, and depression, and then they will hit a manic stage sometimes. Sometimes people even go psychotic during their manic stage. That means that they're out of touch with reality completely, seeing things, hearing things that other people don't see, thinking the TV's talking to them, stuff like that, where they truly are going to be a danger to themselves or to other people, and then that's treatable. And once that's treated with medication and sometimes even electroconvulsive therapy, that's electroshock treatment, extremely effective for people who are in a manic phase. One shock, 2 shocks, and they're back down to a much more normal level, and they get better. And then they can become normal and again function very normally in their jobs and in their families, and as long as they're taking care of their illness.
All right, thank you so much, Doc, for another very
You're
informative
welcome.
discussion. And make sure to join us next week as we talk about the dangers of sitting, something that has become a growing health issue.